Your liver also makes high-density lipoprotein, or HDL, also known as the good cholesterol. HDL has more protein and very little cholesterol and triglycerides compared to LDL. HDL helps remove excess cells and from plaque blood vessels. This is why HDL is called the good cholesterol. HDL turns the excess cholesterol to your liver, which removes it from your.
If you are 20 years of age or older, the National Institutes of Health recommends you have a blood test every 5 years called Fasting Lipoprotein Profile. It measures your levels of total cholesterol, LDL, HDL, and triglycerides. During this test, a blood sample will be taken from your arm or finger after you have not eaten for 9 to 12 hours. The total cholesterol goal should be less than 200 milligrams per deciliter. For most people, an ideal HDL, or good cholesterol, should be 60 or higher. An ideal LDL at the light, turn left, should be less than 100. And fasting triglycerides should be less than 150. Your specific goals may vary depending on your health situation. Ask your doctor what your lipid goals should be. If your cholesterol levels are too high, it's important to eat a heart-healthy diet with lean sources of protein and plenty of fruits and vegetables. For about 19 kilometers, continue straight by the American Lung Cancer Screening Initiative. Lung cancer is the leading cause of cancer-related death. Also, the types of fats you eat can affect your cholesterol level. For example, saturated fats and trans fats tend to raise LDL cholesterol in your blood. These fats are usually solid at room temperature and are found in meat and dairy products, many processed foods, and tropical oils such as coconut oil, palm oil, and cocoa butter. Unsaturated including polyunsaturated and monounsaturated fats, are healthier fats that are usually more liquid at room temperature. They are found in foods such as fish, nuts, and vegetable oils. Other lifestyle decisions you can make to help your cholesterol are not smoking and getting regular exercise, such as brisk walking or running. If lifestyle changes can't reduce your cholesterol levels enough, your doctor may prescribe certain medications to reduce it. Statins are drugs that reduce the amount of cholesterol made in your liver. They affect LDL levels more than HDL or triglyceride levels. Niacin reduces LDL cholesterol and triglycerides and increases HDL cholesterol made in your liver. Bile acid binding resins are drugs that prevent the reuse of bile after helping to digest your food. As a result, your liver uses more cholesterol to replace the lost bile, which means less cholesterol in your bloodstream. Fibrates are mainly used to reduce triglyceride levels in your blood, but they can also raise HDL levels. Cholesterol absorption inhibitors reduce the amount of cholesterol absorbed by your intestines from the food you eat. In many cases, the same steps can help maintain healthy cholesterol and triglyceride levels, such as eating a diet low in saturated fat, trans fat, and cholesterol, getting regular exercise, managing your weight, and not smoking. Type 2 diabetes is a condition in which your blood sugar level is too high. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. Next, the cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside the pancreas detect the rising glucose levels. To reduce the glucose level, your beta cells release insulin into your bloodstream. As the blood circulates through your body, the insulin and glucose exit the bloodstream into your tissues to reach your body's cells. Most cells of the body have certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in a lock to open up the cell so that the circulating glucose can get inside the cell. Now your cell can use the glucose to produce the energy it needs to function properly. If you have type 2 diabetes, either your pancreas does not produce enough insulin, or your body's cells resist its effects, or both. If you have insulin resistance, your insulin cannot unlock the cells to let glucose in because the box, called receptors, are abnormal or missing. As a result, glucose is locked out of your cells. Consequently, the amount of glucose builds up in your bloodstream in a condition called hyperglycemia. To compensate for hyperglycemia, your pancreas produces more and more insulin. Your overworked beta cells try to keep up with the demand, but gradually lose their ability to produce enough insulin. Due to hyperglycemia and the lack of insulin, you may experience the following classic symptoms of diabetes: excessive hunger, excessive thirst, increased urine volume, and unexplained weight loss. Symptoms of type 2 diabetes that may appear over time include fatigue, recurrent infections, changes in vision, itching, tingling or prickling sensations in your skin. Life-threatening complications of type 2 diabetes include diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketonic syndrome, and hypoglycemia. If you don't receive treatment for hyperglycemia, diabetic ketoacidosis can result. Because you no longer have enough insulin circulating in your blood, your cells can't get the glucose they need to produce energy. As a result, your body turns to fats and proteins as an alternative source of energy. During the fat breakdown process, certain byproducts known as ketone bodies accumulate in your blood, resulting in a condition called ketosis. If ketones build up to dangerously high levels in your bloodstream, you may develop diabetic ketoacidosis, or DKA, which can lead to coma and death. Another complication resulting from failure to treat hyperglycemia is called hyperosmolar hyperglycemic non-ketonic syndrome, or HHNS. As the insulin deficiency continues, your blood glucose level increases. In response, your kidneys filter excess glucose out of your blood into urine, along with large amounts of water. Unless you consume large amounts of water, your kidneys cannot keep up with the demand of removing the glucose from your bloodstream and diluting it sufficiently in urine. As a result, your blood becomes much more concentrated than normal, a condition called hyperosmolarity. Hyperosmolarity pulls water out of your body tissues into your bloodstream, causing severe dehydration.
How are you? Trooper back to the state police. Well, I pulled you over, ma'am. You're going 12 miles an hour under the speed limit, and then you're weaving all through the lanes, like you're going like you're on a curve. You'll hit like the yellow line, and you'll ping back, hit the white line. You eating and driving? No. Okay. Any reason why you be driving like that?
No. I saw you behind me, and when you near me, I thought that I slow and
Okay. All right. Where are you folks headed to?
Hey.
Oh, okay. What are you doing down there? Anything fun?
My sister lives
okay.
I'm from Toronto, Canada.
Okay. Well, I'm just gonna give you a warning. It's 55 miles an hour through here, so I know it shows down there. So you can at least go the speed limit and just make sure when you're driving, you're staying in the center of the lanes. Okay. Okay. You guys have a good trip.
Thank you.
Thank you. All right. Let's stop being illegal.
Why?
Jesus.
Why?
I'm scared.
I'm scared too. He keep coming after my back, and then I thought I was slow. That's the reason. If he's just keep his distance, I'm okay.
Just keep being the speed limit.
I know. I keep 45. He said 55. I keep 45. I'm slow. I think I'm slow. I'm not fast. Because he said 55, but when I see the sign, it said 45. That's why I keep below 40, 45, 40, 45. Then he say I'm not like follow the speed.
In about 10 kilometers, turn left onto Pennsylvania 153. Osmolar hyperglycemic non-ketonic syndrome. Neurological symptoms such as seizures and coma can occur. If you take an excessive dose of diabetic medication, you may experience an acute complication called hypoglycemia, insulin shock. Excessive insulin, oral hypoglycemic medication, causes too much glucose to go into cells in an insufficient amount in your bloodstream. Certain organs, such as the brain, need a constant energy supply to function properly. Because the brain's primary source of energy is glucose, it is the first organ affected by lower glucose levels. When your brain cells, called neurons, are starved of glucose, they start to malfunction, causing symptoms such as nervousness, shakiness, and confusion. If your glucose level continues to drop, the electrical activity of your neurons diminishes significantly, resulting in seizures or diabetic coma. Over time, chronic, poorly controlled type 2 diabetes can cause degenerative tissue damage, resulting in long-term complications such as atherosclerosis, blindness, neuropathy, and renal failure. To avoid the complications of type 2 diabetes, you can take steps to keep your glucose level within a normal range using a combination of blood glucose monitoring, a healthy diet, regular exercise, and medications as necessary. You will need to check the level of glucose in your blood frequently with a glucometer. To do this, prick your finger with a small needle called a lancet and place a drop of blood on the strip attached to the glucometer. Based on your blood glucose level, you may need to adjust your meals, physical activity, or medication dose. Eating a healthy diet will help to lower your glucose level when you eat a diet rich in fruits, vegetables, and whole grains, have meals and snacks about the same time every day, consume the right balance of carbohydrates, proteins, and fats, and minimize your intake of high-sugar foods. Getting regular exercise, even just 30 minutes a day, will lower your blood glucose level, decrease insulin resistance, and may lead to weight loss. You may need to take one or more diabetic medications to help lower blood glucose. Some of these medications increase insulin production in your pancreas. Others decrease insulin resistance in your skeletal muscles. Some treatments increase insulin sensitivity in certain tissues. Others promote a slight decrease in absorption of glucose in your digestive system. If your type 2 diabetes cannot be controlled with diet, exercise, and oral medications, your doctor may prescribe insulin and train you to inject it just under your skin. By treating and controlling your blood glucose level, you may prevent the occurrence of complications from type 2 diabetes. Type 1 diabetes is a condition in which your pancreas does not produce insulin, a hormone your body needs to maintain proper blood sugar levels. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules. In 1 kilometer, turn left onto Pennsylvania 153. The cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside the pancreas detect the rising glucose levels. The beta cells release insulin into your bloodstream to reduce glucose levels and to keep your blood. Turn left onto Pennsylvania 153. Most cells of the body have certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in a lock to open up the cell so that the circulating glucose can get inside the cell. For about 27 kilometers, continue straight to reduce the energy it needs to function properly. If you have type 1 diabetes, your pancreatic beta cells lose their ability to produce insulin, resulting in high blood glucose levels and other complications. In type 1 diabetes, your immune system, specifically your white blood cells, mistake your pancreatic beta cells for foreign invaders. In an autoimmune response, white blood cells secrete autoantibodies that destroy your own beta cells. As a result, your pancreas produces little or no insulin. Without insulin, glucose cannot get into your cells, so they are starved for the calories they should be receiving from glucose. In addition, the glucose level builds up in your bloodstream, resulting in a condition called hyperglycemia. Common symptoms of hyperglycemia in type 1 diabetes include excessive hunger, excessive thirst, frequent urination, unexplained weight loss, fatigue, weakness, irritability, and blurry vision. Hypoglycemia can become severely ill because you don't have enough insulin circulating in your blood. Cells can't use glucose for energy. As a result, your body breaks down your fat and protein stores as an alternative source of energy. As fat breakdown continues, certain byproducts, known as ketone bodies, accumulate in the blood, resulting in a condition called ketosis. When ketones build up to dangerously high levels, a life-threatening condition called diabetic ketoacidosis results. If your blood glucose remains high over time, long-term health problems can occur, such as atherosclerosis, blindness, nerve damage, and kidney disease. If you have type 1 diabetes, your goal is to keep your blood glucose within a normal range. This is done through a combination of proper insulin replacement, monitoring your blood glucose, and, just as importantly, eating a healthy diet and getting regular exercise. Because your pancreas no longer produces insulin, you will need to take insulin to replace what your body should be making. A licensed healthcare professional can train you to inject the insulin just under the skin. You will need to give yourself injections several times each day and rotate injection sites to avoid tissue damage and absorption problems. Another way to get insulin is through an insulin pump, which is attached to your body and delivers insulin through a tube implanted just under your skin. You will need to check the level of glucose in your blood several times a day with a glucometer. To do this, you will prick your finger with a small needle called a lancet and place a drop of blood in the glucometer. Knowledge of your blood glucose level allows you to adjust your insulin dose, calories you eat during meals, and physical activity. You need to eat a healthy diet and get regular exercise to manage your glucose level and reduce your risk of cardiovascular disease. It's in your heart, two chambers called ventricles trap blood to your lungs and flows through them. That can affect the pressure on your lungs. Cardiac health, as cardiac health increases. Center of the blood is blood volume, or the total amount of blood in your body. Blood pressure also goes up as blood volume increases. The third factor that affects your blood pressure is resistance, which is anything working against the blood flow through your arteries. Several factors contribute to resistance. One resistance factor is the flexibility of your artery wall. Healthy arteries expand with each heartbeat to help reduce blood pressure on the wall. Another resistance factor is the diameter of your arteries. Your body is able to increase the diameter of your arteries to lower your blood pressure, and reduce the diameter to raise your blood pressure. A third resistance factor is blood viscosity or thickness. In your blood, air particles such as proteins and fat increase viscosity. If your blood is thicker, your blood pressure goes up as your heart works harder to push it through your arteries. Your blood pressure can be measured with a device called a sphygmomanometer or blood pressure cuff. When your heart beats, the pressure of blood on the walls of your arteries is called systolic pressure. When your heart relaxes between beats, pressure of the artery wall is called diastolic pressure. Will your blood pressure change through the day? Or your diastolic pressure, monthly studies have high blood pressure. Over time, high blood pressure will damage the walls of your arteries. Your artery wall may become weak and form an enlargement called an aneurysm, or the wall may burst and feed into the surrounding tissue. Small tears in your artery wall may attract certain substances in your blood, such as cholesterol, fat, and calcium, to form a buildup called a plaque. Blood flow through your artery decreases as the plaque enlarges. Blood cells can stick to the plaque and form solid clumps called clots, further reducing or completely blocking your blood flow. Damage to your arteries raises your blood pressure even by making your heart beat more forcefully. Artery damage and reduced blood flow lead to conditions such as a stroke, heart attack, or kidney disease. In most cases, the cause of high blood pressure, hypertension, is unknown. This type of high blood pressure is called primary or essential hypertension. Treatment for essential hypertension includes lifestyle changes, such as eating a healthy diet. If you are sensitive to the sodium in salt, your doctor may recommend limiting your intake of salt and highly processed foods. Sodium may cause your body to retain water, which increases both your blood volume and your blood pressure. Other lifestyle changes that can reduce blood pressure include avoiding excessive alcohol intake, getting regular exercise, losing weight if you are overweight, and quitting smoking. Your doctor may also recommend medications that act on your kidneys, blood vessels, or heart to help reduce your blood pressure. Diuretics, commonly called water pills, cause your kidneys to move more salt and water from your blood into your urine. It reduces your blood volume and pressure. Beta blockers reduce the workload on your heart by decreasing both the rate of your heartbeat and the strength of your heart's contractions. Several types of drugs act directly or indirectly to reduce your blood pressure by relaxing your blood vessels, which increases their diameter. These drugs include ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, and direct-acting vasodilators. Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The pumping sections of the heart are the right atrium, right ventricle, left atrium, and left ventricle. In your heart, oxygen blood moves from your body through large veins into your right atrium. Next, your blood moves into your right ventricle, which contracts, sending blood out of the heart to pick up oxygen from your lungs. Oxygen-rich blood moves out of your lungs into your left atrium, then moves into your left ventricle. Finally, your left ventricle contracts, sending oxygen-rich blood out of your heart to your body. If you have heart failure, your heart has lost the ability to pump enough blood to meet your body's needs. You may have weak or damaged ventricular walls that are not able to push enough blood out of your heart. You may also have stiff and thickened ventricular walls that do not allow your heart to fill. In about 10 kilometers, turn left to merge onto I-80 toward Belfort. If you have left-sided heart failure, your left ventricle does not deliver enough oxygen-rich blood to your body, making you feel tired and out of breath. Your failing left ventricle also increases the blood pressure in the blood vessels between your lungs and left ventricle. This increased pressure forces fluid out of your blood and into your lung tissues, which makes it difficult for you to breathe. If you have right-sided heart failure, your right ventricle is unable to contract enough force to push blood to your lungs. The result is a buildup of blood in your veins, which causes a buildup of fluid called edema throughout the tissues in your body. Over time, heart failure on either side of your heart results in weakened and enlarged ventricles that deliver less blood to your body. To make up for the decreased amount of blood, your nervous system releases stress hormones that increase the speed and force of your heartbeat. Unfortunately, these stress hormones make your heart failure worse because they damage the muscle cells in your ventricles. The most common cause of heart failure is coronary artery disease. Other causes that damage your heart and lead to heart failure include blood pressure, diabetes, diseased, infected, or damaged heart valves, diseased, infected, or damaged heart muscle, irregular heartbeats called arrhythmias, heart defects, poisons or substance abuse, lung diseases, and breathing problems during sleep called sleep apnea. Treatment for heart failure includes medications, lifestyle changes, or in extreme heart failure, heartbeat assisting devices or surgery. Diuretic medications reduce the swelling in your body by increasing the amount of urine produced by your kidneys. ACE inhibitors are medications that allow your blood vessels to expand. This helps decrease your blood pressure and prevents further damage to your heart by making it easier for your heart to pump blood. Beta blockers are medications that block the effects of stress hormones on your heart. Although beta blockers slow down your heartbeat, they are mainly used to protect your heart muscle from the long-term damage caused by stress hormones. You may need to make some lifestyle changes, including exercising on a regular basis, maintaining a healthy weight, quitting smoking, limiting salt and alcohol, and eating a heart-healthy diet. Surgeries for advanced heart failure include coronary artery bypass surgery to improve blood flow to your heart muscle, heart valve reconstruction surgery to improve blood flow through your heart, and left ventricle reconstruction surgery to remove damaged heart muscle. Surgeries for extreme heart failure include insertion of the legs to help the heart flow blood, and heart transplant.
Diabetes with heart failure. Some kind of congestive heart failure. CHF. And pump enough blood and oxygen to meet the needs of your body. Excess fluid builds up in the lungs, legs, and other body tissues. The symptoms of heart failure include shortness of breath, chronic coughing or wheezing, swelling of the legs, feet, or abdomen, weight gain, feeling tired all the time, nausea or lack of appetite, heart palpitations, difficulty lying flat due to feelings of suffocation, and having to sit up to breathe. Over time, heart failure weakens your heart and can shorten your life if not well managed. Fortunately, you can help control your symptoms by following your doctor's instructions, adopting a heart-healthy lifestyle, and staying aware of changes in your symptoms. Following the instructions of your healthcare team is very important in managing your symptoms and preventing
1 kilometer, turn left to merge onto I-80 toward Belfont.
includes taking your medications exactly as prescribed by your doctor. Don't stop taking your medications or skip doses.
Use the left lane to merge onto I-80 East toward Belfont.
If the cost of your medication is an issue, discuss other options with your doctor. Your medications may include angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers,
Turn left.
or angiotensin receptor neprilysin inhibitors, beta blockers, mineralocorticoid receptor antagonists, also known as aldosterone blockers, or sodium glucose cotransporter 2 inhibitors. These medicines are important in managing heart failure. Don't take any over-the-counter medication or supplement without asking your doctor if it's okay. Make and keep all of your follow-up appointments for both doctor's visits and lab tests. Get
In
vaccinated.
about 19 kilometers, take exit 123 onto Pennsylvania 970 toward Woodland.
Failure also means adopting a healthy lifestyle. You may need to make the following changes. Eat a heart-healthy diet, including low-fat, cholesterol, and high-fiber foods. A heart-healthy diet helps you maintain or achieve a good blood pressure and weight, and helps prevent other conditions that may further stress your heart. Check food labels for the amounts of these ingredients and others. Limit your salt and sodium intake to 2,000 milligrams a day, which is less than a teaspoon, by doing the following. Don't not add salt when you cook. Just at the table. Processed and fast foods. Compare food labels and choose the items that are lower in salt and sodium. Limit your alcohol intake. Ask your doctor if your condition allows you to include any alcohol in your diet. Monitor your fluid intake. Too much fluid makes your heart work harder. Ask your doctor how much fluid is the right amount for you. Don't smoke. Nicotine increases heart rate and blood pressure. At the same time, it decreases the amount of oxygen-rich blood delivered to your body's tissues. Become physically active. Regular exercise. You need 30 seconds of your day. You can feel better. Exercise options with your doctor's approval. Walking, swimming, and bicycling. As you exercise, keep these precautions in mind. Rest as needed. Stop if you feel chest pain or unusual shortness of breath. And don't exercise when temperatures are very hot, very cold. Your doctor may also prescribe a cardiac rehabilitation program that is a combination of medically supervised exercise, lifestyle counseling, and education. It is important to stay aware of changes in your symptoms and know when to get help. Using the traffic light colors green, yellow, and red to assess how you feel can help you take the proper action to manage your heart failure symptoms. It means that your symptoms are under control. Continue to follow your doctor's directions and keep all medical appointments. Weigh yourself daily to see if your body is retaining fluids. Do it at the same time each day before eating or drinking, and wear the same type of clothing or no clothes at all. Record and take note of any changes in your weight. Symptoms in the yellow zone are warning signs. Call your doctor immediately if you gain 2 to 3 or 4 pounds in one day, or 5 pounds in 1 week. Have an increased shortness of breath. Have difficulty sleeping due to trouble breathing. Feel persistent, fast, or irregular heartbeats. Or feeling lightheaded, or as if you may faint. Red zone symptoms are emergencies that mean you need medical evaluation right away. Call 911 if you experience chest pain that lasts more than 15 minutes, severe and ongoing shortness of breath, coughing up pain, frothy foam, or fainting. Staying on top of your symptoms and following your doctor's instructions can help you manage heart failure and reduce your trips to the hospital. To find out more about managing heart failure, talk to your healthcare practitioner. Seven symptoms of heart attack 1 month before. Are you aware that every 40 seconds, someone in the United States experiences a heart attack? For the past decade, there's been a noticeable increase in heart attacks, particularly among individuals under 40 and women. Surprisingly, 1 in 5 women is at risk of experiencing a heart attack. According to international health authorities, cardiovascular diseases are responsible for 1 million deaths annually. That's over 30 individuals every minute, surpassing fatalities from cancer and traffic accidents combined. The insidious nature of these diseases lies in their silence. Often, we only become aware of the danger when it's far too late. This is largely because the critical early warning signs preceding a heart attack are not widely known. Today, we will discuss together the reasons behind the rising number of heart attack cases. We'll delve into why this alarming trend is affecting younger populations, including both men and women, and even those who previously showed no signs of cardiac issues. Often, heart attacks strike when least expected, underscoring the need for awareness and preventative measures. Let's discover the 7 signs your body might exhibit a month or just days before a heart attack? Stay tuned until the end of this video, as I'll also unveil the factors contributing to the alarming rise in heart attacks among individuals under 40. If you recognize any of these 7 symptoms, you might be only days away from experiencing a heart attack. It's crucial to consult a cardiologist immediately, as any delay can lead to irreversible damage to the heart. Let's begin with the first symptom of a heart attack 1 month before. Symptom number 1, cold sweat and paleness. In fact, up to 30% of individuals who've had a heart attack and experiencing this in the days leading up to the event. What sets this apart from normal sweating when experiencing a cold sweat related to heart? It appears subtle and is markedly different from the sweat produced when you engage in physical activity. Sticky and cold, often accompanied by a feeling of chilliness on the forehead throughout the body. You might notice a sudden paleness in your skin. This symptom can be unknown, resolving spontaneously healing during any routine activity. It tends to happen. Especially take it seriously. Ordinary symptoms may be indicating that your heart is in distress. Seeking medical attention promptly could be vital in preventing a heart attack. Symptom number 2, fatigue or short of breath. This symptom is critical. A staggering 70% of women who have experienced a heart attack reported feeling fatigue or short of breath in the days or even hours leading up to the event. This isn't ordinary tiredness. It's fatigue. Such profound weakness or muscle fatigue, especially if it's a new development within the last 30 days, warrants your attention. Pay special attention if you suddenly find yourself short of breath after minor activities like walking a block or climbing stairs.
In 2 kilometers, take exit 123 onto Pennsylvania 970 toward Woodland.
These signs would indicate clogged arteries, a precursor to a heart attack, even if you don't feel any chest pain. Determining whether your shortness of breath or fatigue is a heart issue or something else like anemia, bronchitis, or just a lack of physical activity can be perplexing. There are 2 critical indicators that suggest your symptoms may be heart-related. A recent and notable increase in symptoms, especially if they are new or have worsened recently, and the presence of heart disease risk factors. The combination of symptoms and your personal health history paints the full picture. Symptom 3, jaw pain.
Take exit 123 onto Pennsylvania 970 toward Woodland. Then take the first right onto Shovel Highway.
Might be linked to your gallbladder or liver. Pain in your jaw, particularly on the left side, could signal a heart problem, possibly warning of an impending heart attack. This phenomenon is
Turn right onto Shovel Highway toward Woodland.
as we develop in the womb, our organs form with nerves that originate from other parts of the body. As a result,
In about 15 kilometers, take exit 133 onto Pennsylvania 53 toward Phillipsburg.
if you experience unusual or persistent jaw pain, especially if it's on the left side, consider it a potential warning sign. It's not just about where the pain is, but understanding that sometimes pain in one area can indicate a serious issue elsewhere. Remember, while jaw pain can have many causes, if it's accompanied by other symptoms of a heart attack or you have risk factors, don't take it lightly. It's always better to be cautious and seek a cardiologist urgently, especially if it is accompanied by the other signs I'm going to tell you about. 4. Discomfort. This symptom is particularly prevalent among women and the elderly. It's not just any stomach pain, it's a pain that might mimic gastritis, but isn't. You might notice stomach bloating during or after meals, or even pain while walking or exerting yourself. These are the moments when it's crucial to consider that the root cause might be your heart, not your stomach, especially if you fall into the high-risk categories for atherosclerosis, being over 50, though it can occur at any age, having diabetes, high blood pressure, obesity, especially excess visceral fat, smoking, or regular exposure to secondhand smoke. You need to be extra cautious. If this resonates with your experiences, especially if you have the mentioned risk factors, I urge you not to dismiss these signs. They could be the early warnings your body is giving you about an impending heart attack. Early detection could be the key to saving your heart and potentially your life. Don't underestimate these symptoms. 5. Back pain. Pain around the scapula, the lower part of the neck, especially on the left side, was a precursor to a heart attack or indicated a problem with the aorta artery, one of the largest arteries in our body. It's easy to dismiss this as mere muscle pain.
Proceed to the root.
You need to be cautious. If the pain doesn't improve with changes in position or self-massage,
2.3 kilometers. Take exit 123 onto Pennsylvania 970 toward Woodland.
this kind of pain is persistent and doesn't respond to usual remedies. The aorta is responsible for delivering blood to almost all parts. Diseases that weaken its wall can lead to the formation of ulcers or tears, resulting in very intense pain between the shoulder blades. Such aortic issues are medical emergencies and require immediate attention. If you're experiencing this type of back pain, particularly if it's a new symptom and doesn't respond to typical treatments, it's crucial to consider the possibility of a heart or aortic problem. The nature of the pain associated with heart or aortic issues is distinct and severe. In the case of aortic problems, the pain is intense, feeling as if something is piercing you from the front of the chest straight through to the back. However, when the pain is related to a potential heart attack, it tends to be milder but still significant, like a persistent pressure in the back. It's usually not constant. Instead, it comes and goes, generally lasting.
Take exit 123 onto Pennsylvania 970 toward Woodland.
Like back pain. Don't dismiss new or unusual back pain. It could be your body alerting you to a serious condition. 6. Numbness of the left hand and arm. Over the past month, have you experienced a slight pain or numbness in your left arm and hand, especially during activity?
At the stop sign, use the left lane to turn onto Shovel Highway towards Woodland.
While it's true that various health problems can cause such numbness, it's crucial to consider the context. If this symptom is new to you, if you possess the
Turn left.
heart disease that I've previously mentioned, and if there's no other logical explanation for this sudden change, then it's time to take action. If you're at risk for heart problems, consulting a cardiologist could be a vital step.
In 2.5 kilometers, turn left onto Woodland Bigler Highway.
Beware of sudden dizziness, feelings of faintness, or episodes of low blood pressure that appear out of the blue. These symptoms, especially if they've started recently and occur during physical exertion, like walking a block, climbing stairs, or even while eating, should not be ignored. Many patients who experience these symptoms and are later found to have significant heart issues undergo cardiac catheterization. This diagnostic procedure, which involves administering contrast to visualize the coronary arteries, often reveals that the obstruction is nearly complete. Why do heart attacks occur? It all starts with the heart's vital role, pumping nutrient and oxygen-rich blood throughout the body, including to the heart muscle itself. The coronary arteries nestled in the heart's walls are tasked with delivering this blood directly to the heart. A heart attack, also known as acute coronary syndrome, happens when these crucial arteries become blocked. This blockage can arise from various factors, including cholesterol buildup, calcium deposits, and inflammation in the artery walls, all of which hinder the free flow of blood. The primary culprit behind these blockages is often atherosclerosis, a condition where the arteries harden and narrow. What makes atherosclerosis dangerous is its silent nature, often presenting no symptoms until it's too late. Atherosclerosis is similar to a slowly growing plaque of cholesterol and inflammation within your artery.
At the next light, turn left.
Gradually obstruct blood flow, potentially leading to heart attacks or sudden death if left unchecked. Heart attacks can occur from partial artery blockages as well, where inflamed plaque ruptures, leading to a clot that suddenly blocks blood flow, causing the heart.
At the light, turn left onto Woodland Bigler Highway.
You may notice pre-heart attack symptoms due to temporary blood and oxygen shortage and soon. Often appear during moments of stress or high emotion, like during a fright, an argument,
or intense physical exertion. Poor sleep or any situation that significantly accelerates the heart can also be a trigger. However, remember, these symptoms can arise at any time, day or night. Stay alert to any unusual physical changes, especially if they occur during. Recognizing these signs early on could save your life. How can you distinguish?
For about 18 kilometers, continue straight.
When a heart attack occurs, it means that a part of the heart muscle has been irreversibly damaged due to a lack of blood supply. Individuals experiencing a heart attack report persistent tightness or a sensation of pressure in the chest. This discomfort lasts for an extended period, often many minutes, and doesn't simply fade away. Furthermore, a heart attack may bring additional distressing symptoms such as nausea, vomiting, shortness of breath, intense feeling, a cold, the typical difference typically only a short while, be 10 to 15 minutes. Often it quickly improves when the person rests, sits down, or takes a vasodilator tablet under the tongue. If you've been experiencing any of these symptoms, consider them not just as warnings of potential clogged arteries, but as a reminder that there's still time to act. Save your heart. Sign of these symptoms, it's imperative to seek medical help immediately. Go to the emergency room, call an ambulance, and inform a family member. Remember, in matters of the heart, every second counts. Over the last 15 years, heart attack hospitalizations in those 39 and younger have increased by over 60%, particularly in women, with deaths rising by more than 10%. This surge is linked to the growing prevalence of atherosclerosis in the young. Modern life, which makes many tasks more convenient, has its drawbacks. With just a tap on our phones, we can easily order fast food. Heart attacks can be prevented by modifying a few lifestyle habits. If you smoke, make it a priority to quit. Stopping smoking can reduce your risk of a heart attack by 30%. Keep your blood pressure under control. Are you diabetic? Ensure your blood sugar levels are well managed. Adopt a healthy diet. This significantly create your cardiovascular risk. Processed foods and increase your intake of fruits, vegetables, and whole grains. Cut down on sugar and incorporate more olive oil into your meals. Are you dealing with high cholesterol? Seek treatment. If you're dealing with obesity, prioritize weight loss. Leave the chair behind and embrace activity. Also, ensure you're getting quality sleep. Aim for 7 to 8 hours per night. And importantly, get a regular cardiovascular checkup. Cardiovascular diseases shouldn't even be among the main causes of death globally, yet today they top the list. Let's each do our part to change this narrative by taking these preventative steps.
In about 10 kilometers, turn left onto East Beaver Street.
Have you or someone you know exhibited any of these symptoms before a heart attack? Leave your comment below. Share this video with your friends and family. You could save a life. If you haven't subscribed yet, subscribe to our channel. Also, allow the notifications so you don't miss our upcoming videos. And what will be the next video you watch? I'll leave 2 recommendations here. Your engagement helps us a lot to continue growing. See you in the next video. Bye. You start to sweat, you just regular sweat. The thing that makes your body sneeze. The pain and then you start to show heavy pressure. Having cardio resection. Responsive. What should you do? That just give it College, friends and family by sharing radio with me. So parents. Yes. Yes. Very fun. Write it down below. Especially recommend tablets because special patients to diabetes causes all the symptoms. It's just pain, destruction, and therefore, they have for ignorance of the notion that especially when accompanied by other scientists. That symptom Dizziness or feeling faint. Dizziness can be caused by a change in pressure, weakness, or even stress in women. Dizziness can also be a predominance. Things are covered by all of their signs, dawning in office. Sometimes numbness or heaviness in the arm, delayed numbness or heaviness, maybe the left arm, also during the right arm, in the hands, or even without degree nerves. Because from the heart, as if they were coming from the arm, to the connection between the nerves. Third time, hardness of breath, difficulty breathing, or a feeling of suffocation may occur with or without chest pain. This may be a result of heart not pumping efficiently. Times, attack can be caused by adrenaline rush. Right. It's something terrible. Is about most frequent and chest pain. This a heart attack pain feels like it is an intense pain. The center of the chest. It may feel tight, oppressive, or crushing, as if an elephant was sitting in your chest. This pain may radiate to the arm, to the jaw, or to the back, and generally affects the chest. Okay, you have the symptoms and signs, and you're not alone. Many of my patients who survived a heart attack tell me that they just knew something very bad was happening at the time, that they need urgent help. What is the first step that you should take if you were experiencing this? A heart attack is a medical emergency. Time is of the essence. Every second can make a difference. That's why the first and most important step is take you to the ambulance. Your wife, your son, your boyfriend. The ambulance will take more than 15 minutes. Remember this number. Or a taxi, knock on the neighbor's door so they can take you to the nearest hospital. The faster you can get to the hospital and get treatment, the better your chances of survival. Now you might be thinking, if time is so important, wouldn't it be faster to just get my car and drive to the hospital? Yes or no? And let me explain why. During a heart attack, your heart is suffering. A heart attack happens when the blood flow to the heart is blocked. Usually black clot that forms on a very plaque that has built up in the walls of a coronary artery. This blockage prevents the heart muscle from receiving oxygen. Without oxygen, heart cells begin to die, and the longer it goes untreated, the more damage there is to the heart.
In 500 meters, turn left onto East Beaver Street.
That suddenly becomes completely clogged. The muscle suffers, and depending on the area affected, this can lead to death within minutes. That is why time is so important. 50% of deaths from heart attack occurs within
Go past this light, then turn left onto East Beaver Street.
Sudden drop of blood pressure, or even develop a serious cardiac arrhythmia. This can lead to a sudden loss of consciousness while you're driving. Imagine you pass out at the
Turn left, then take the first right onto South Center Street.
lives of other people on the road.
Turn right.
And even
For about 23 kilometers, continue straight.
of steering and changing gears can worsen the lack of oxygen to the heart. If you feel short of breath, dizzy, or have worsening chest pain, there is no way to react to these symptoms while you are behind. That's why I always insist. Ask someone to take you to the hospital or wait for the ambulance. And of course, it's important that you ensure the first responders can help you quickly and effectively. Keep the doors unlocked. If you have pets, keep them in a closed room. This will prevent complications when emergency services arrive to help you. And also keep the list of your medication and allergies handy. That's why I always recommend that my patients keep their prescription on their cell phone or on an accessible place, such as their wallet or purse. What to do while waiting for help? Stay calm and conserve energy. I know that it's hard to stay calm in such a critical moment, but panic can make the situation worse. Try to breathe So it helps reduce the strain on your heart and conserves energy for your body. Sit or lie down in a comfortable position. Choose a position that helps relieve pressure on your heart. Sit with your back supported and hands slightly elevated. This keeps blood flow and prevents you from falling if you lose consciousness. Also avoid any physical exertion. Don't try to lift weights out a lot or do chores. The goal is to protect your heart. Remember, every movement requires more effort from the heart muscle. If possible, take your aspirin. If you have no allergies or contraindication, 2 or 3 tablets of 100 milligrams aspirin. You heard me right, chew it to make the aspirin work faster. Chew the tablet before swallowing, 7 taking. Then hold this wallet. Chewing speeds up the absorption of the medicine into the bloodstream, providing a faster effect. Aspirin acts as an antiplatelet, which means it prevents platelets from clumping together as for the exhaust. This can reduce the extent of the blockage and allow blood to continue flowing, even if only partially, until you receive specialized medical care, reducing the impacts of the heart. Of course, you won't buy aspirin at the emergency. You will have it at hand. You may have heard that can see your life during a heart attack, and it's time for me to develop this idea. So-called CPR is most information on the internet for reviews, but it has no medical or scientific base. Remember what I said earlier. The heart attack occurs when blood to the heart muscle is blocked, usually by a clot. At this stage, the heart isn't paying, but it's still beating. This means when your tissues you have a vasodilator. You should take it unnecessary self-medication. Yes, something that is actually part of the treatment of heart attack with vasodilators will not reduce mortality. And if you have taken 10 milligrams of Cialis or Viagra, you can die because of the vasodilator. Not to mention that in the right ventricular infarction, you can also kill the person if you take a vasodilator. So, unconscious and with no signs of breathing it is essential to act. He or she can have narrative characterized by its rapid progression and high vitality. It occurs when the coronary artery, usually the main artery, is completely and abruptly blocked, leading to sudden cardiac arrest within minutes or hours. Heart attacks result in sudden death. Typically, massive pressure on